Okay, we are continuing our discussion of genomics and cancer, and we're going to talk about how cancer develops, and this is also known as the process of malignant transformation, oncogenesis, or carcinogenesis. There are four components to it: initiation, promotion, progression, and metastasis. This is a stepwise process that happens predictably in every different type of cancer. So this is a process of changing a cell that has a normal phenotype. It looks like a normal cell, it acts like a normal cell, and then it becomes malignant. It does something harmful to the body, and that is what its phenotype is. It's also known as oncogenesis and carcinogenesis. So if you see that in your reading, know that that means essentially the same thing. It occurs in a very predictable pattern through multiple steps. It's dependent on time, and it's pretty well characterized, even for cancers that are very heterogeneous. Skin cancer will go through the same progression as bone cancer or kidney cancer. It'll vary a little bit in how it looks and where it goes, but generally it's the same process. Now, cancer is sort of a race against time. Our bodies were built to destroy abnormal cells to keep everything functioning in a cohesive, healthy body. But when cancer cells multiply more rapidly than our defenses can eliminate them, we have disease. It involves cell alterations at the gene level. If you don't know oncogenes and suppressor genes by now, go back and look them up, because those are generally where the mutations occur within the cell that cause this rapid proliferation of abnormal stuff. A single cell can give rise to cancer, and that's important to know. Although typically the processes of the body, if it's not occurring that often, won't allow that to happen. So here we have like a little diagram, tumor progression in colon cancer. So we start with normal, healthy colon tissue, and you see all those cells. They're sticking together. They have all the characteristics of normal cells, and they're sort of orderly, not too many of them. And then we have the loss of the APC gene. That is a suppressor gene. So it doesn't function anymore, and you get like this little polyp. The cells grow. They're all normal cells, but there's too many of them, and they bunch together. So that's a polyp, and it's benign. And if we remove it, it will never progress to cancer. It grows into a larger polyp, still benign. If we have that loss of function in the RAS gene, which is another suppressor gene, so it's still growing, but it's still essentially a normal phenotype. And then we get this loss of P53 function. That's another suppressor gene. And now, all of a sudden, it has gone from being a normal tumor, a benign tumor, to a cancerous cell. And this cancerous cell will further develop until it becomes invasive, and it can break off and land in other body tissues and set up shop, where it's going to continue to multiply, invade, spread, and cause disease until the host dies. So the process goes like this. You have that normal cell, and then there's something that mutates the cell. It turns off a suppressor gene, or it activates an oncogene that should be silent. And there's growth, and there's mutation, further mutation, so it looks less like a parent cell. But we have that first mutational event, that's initiation. Then we have this latency period. It can be months if the exposure is to a very strong carcinogen, like a nuclear explosion, or it could be years when it's a slow process of damage to cells, like for lung cancer. People don't get lung cancer from smoking just one cigarette, or being exposed to secondhand smoke one time. It happens over a period of years. We have this promotion. So different agents in the environment and within the body promote the development of abnormal cells until we finally progress to an identifiable tumor that can break off and invade to other places. So that's sort of that stepwise procedure, second time. So it's a concept that's fairly important for you to know. The steps in malignant transformation, we start with a single mutational event that initiates the process. We now have an abnormal cell that is inclined to grow without inhibition. Then we promote that. We kind of fan the flames with repeated exposures to environmental agents. The cancer cell will progress and become more and more abnormal until there's an identifiable tumor. That tumor will have characteristics of cancer cells. Again, this doesn't always happen overnight. Cancer can be in situ for years in the site where it originated before it starts to break off and metastasize. But metastasis is sort of the end game. That's when the tissue where the cancer is no longer its home. It breaks off, it moves out, it starts to develop a blood supply, it invades healthy normal tissue, it grows, and then it can spread widely throughout the body. That process can take up to 25 years or longer. Rate of progression depends on a lot of things. It depends on how frequent those cells have to turn over to begin with. Our skin cells are constantly sloughing off and being repaired. So skin cancers can develop. You do see 20-year-olds with skin cancer after exposure to tanning beds. Loss of protective factors, those suppressor genes, immune factors. So anything that decreases your immune function can promote the development of cancer and make it progress faster, and repeated exposure to carcinogenic agents. Cancers can be interrupted before they start by minimizing exposures, or they can be interrupted during the latency period if we slow down our promotion of that cancer until the body can sort of eliminate it. The body was designed to eliminate these abnormal cells. We can overwhelm its defenses. Here's another graphic, the same progression. We have normal cervical cells. They stick together. They're very highly organized. They look normal with a small nucleus. Then these 4 cells initiate. There's a change. They're exposed to HPV, which is a virus, and they're damaged. They start to overgrow, and they start to look mildly abnormal because there is dysfunction in the suppressor genes, and we get mild dysplasia. That's when people will go for pap smear and they'll see mild dysplasia. And it's not considered cancerous. We don't really have a tumor yet, but we can intervene to get rid of that dysplasia. It'll grow till it overgrows, till we get severe dysplasia. We get very abnormal cells, but it's still in situ until it breaks off and invades. Now, if you look at the pattern of time, initiation starts here. In 6 to 10 years, we might have mild dysplasia. In another 5 to 10 years, we might have severe dysplasia. It takes maybe another 10 years. I mean, it could be 30 years before this person develops invasive cancer. So if we're screening this person annually or every 3 years, depending on what the recommendation is for that person, we have time to address this issue when it's here. And that's kind of where the rubber hits the road. If you know that the person has HPV, they've tested positive for it, and you see on a pap smear that they have mild dysplasia, and you do a LEAPS procedure and it eliminates those abnormal cells are no longer there, and we took a margin of healthy tissue to make sure there were none, it never progresses to invasive cancer. So not all cancers grow that slowly, but cervical cancer is a good example of how we can prevent death from cervical cancer by surveilling, especially people who are at higher risk for HPV. Vaccinating against HPV would stop it at the level of initiation. So think about that. Initiation is our first step. And this is where the first mutational events happen. Oncogenes can be overexpressed. Suppressor genes are silenced. Guaranteed to have an exam question on that. Irreversible event. You can't go back to normal after you've changed that cell. And it can lead to cancer development if we allow things to go out of control. Most cancers come from cells that can reproduce. They're already reproducing. Cells that don't normally divide, like cardiac muscle, can become cancerous, but it's very, very rare. It's why you don't hear about heart cancer. Cancer cells can invade cardiac muscle, skeletal muscle, or neurons, but generally they come from somewhere else. Usually it's cells that are already reproducing. Carcinogens are substances that can induce mutations in cells, and that can be part of initiation, or it can be a promoting factor. We already have an abnormal cell that wants to grow, grow, grow. Now it's going to further mutate that cell so that it acquires characteristics that are harmful to the body. You might be initiating cancer right now. Every day, people have initiation events, but they don't always lead to cancer because the body was designed to eliminate those abnormal cells. It's only when we stop the normal processes that we get cancer. So there are points at which you can prevent it. So many exposures are considered carcinogenic. This is a partial listing, and there's a nice little graphic for you, things that are definitely known to cause cancer, some things that are associated with cancer, where the evidence is less strong. Radiation, tobacco smoke, we all kind of know these. Things that you might not be aware of, obesity can be a carcinogen, and I'll discuss that in a separate slide. Viruses, HIV, HPV, hepatitis. It's why vaccines for HPV and hepatitis are so important. They prevent progression of abnormal cell development to cancer. And things that we eat, processed meats, grilled meats, can be associated with cancer. Evidence is not as strong as it is for, say, tobacco smoke or solar radiation. Promotion. So we have an abnormal cell. If it stays just as a cell that wants to grow, it'll be a benign tumor, but it won't necessarily develop all the characteristics of cancer. There is a latency period. The time between that initiation event, that first mutation where the oncogenes or suppressor genes are altered, and the development of an identifiable tumor. That latency period can vary. Things that make a difference: strength of the carcinogen. So if you're exposed to a nuclear blast, like Hiroshima, that latency period is very short, might only be months. If you are exposed to, insulin like growth promoting factors and they create a increased risk for cancer, it could be 25 years. So the dose of the exposure, how much, the individual susceptibility to cancer, that goes with familial cancer syndromes, which we'll talk about later. Also, things that are personal and not necessarily in your genome, like aging, will make your DNA a little less stable as those telomeres shorten and as cell function decreases and immune function decreases. A person's BMI can increase their susceptibility to cancer. Those things, a person's, types of exposures, multiple exposures, can promote, let's say that it was tobacco smoke that initiated the cancer, alcohol can promote the development of that cancer. Gender. So women are more likely to have a short latency period for things like lung cancer than men. So that's the latency period. It's that time. Promoters are substances that enhance growth of the cancer cell. So hormones that the body produces can serve as promoters, especially when they are in excess. So insulin, when we have people who are insulin resistant, we note that they are more susceptible to cancers of different kinds. So people who have prediabetes, diabetes, PCOS, other insulin resistant conditions can have that cancer promoting factor because it will help cancer cells to grow and help them uptake glucose and make them more aggressive. Estrogen is another famous promoter of cancer, especially breast and ovarian cancers. Many of those are receptive to estrogen, and that's one of the ways we might even treat them is by blocking their uptake of estrogen. So inflammation promotes cancer. So you have the initiation event, and then if we have further inflammation, the damage to the cells are going to send signals, grow, 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 grow. And that inflammation is under investigation because there are many conditions in the body that lead to increased low levels of inflammation, serve as cancer promoters. Obesity promotes cancer, both through that low level of inflammation that's caused by excessive fatty tissue, especially visceral fat, and exposure to hormones like estrogen, which is stored in body fat, and insulin, because people with excessive body fat are more insulin resistant. They need to produce more insulin, and that insulin can be used as a growth promoter. Complete carcinogens are things that can initiate and promote cancer. For example, radiation can both turn on that abnormal change and accelerate its progression. So people who have had radiation, now you know that we sometimes use radiation to destroy cancerous tissue, but people who have had radiation therapy for cancer are at increased risk subsequently for the development of other cancers because radiation alters healthy tissue. All right, progression, continuing changes in the genome of a cancer cell. Remember, I showed you that visual of the karyotype of a cancer cell. That cancer cell will get more chaotic and more disorganized and have fewer characteristics of a euploid normal cell, but it will also develop self-sustaining mechanisms. It's a little like a narcissist, remember. So it's going to allow the cell to develop a blood supply so that it gets a preferential treatment from the body. It's going to get more oxygen, more nutrients. And there are also changes that will enhance cellular nutrition. So the cell membrane in a cancer cell becomes directly permeable to glucose. It doesn't need insulin to open the door. It'll take up all the sugar. It will grow faster in the presence of insulin because now it really has a lot of fuel, but it doesn't really strictly need insulin. So even if the host has poor nutrition, which happens often in cancer, this tumor cell is going to get what it needs. Cancer cells meet their needs at the expense of normal cells. They will starve out normal cells to meet their own needs, and they become less and less differentiated. They lose the function of the parent cell. So they will still look like a cancer cell, a normal cell in some ways. That's how we will determine where the cancer originally came from. But it won't have any function. It doesn't contribute anything to the body. All it does is take. Metastasis happens. We have this, the cells don't want to stick together anymore. They lose their cell adhesion molecules and they break off and travel to other sites. Usually that begins in the lymph nodes because the lymph nodes are very hardworking organs, tissue, acting as garbage collectors. They pick up the things the body doesn't need and kind of store it and get rid of it. But cancer cells don't want to die, so they just hang out in the lymph nodes and they grow there. Expression of enzymes, lytic enzymes that are on the surface of the cancer cell, will allow it to destroy the cell membrane and penetrate other tissues. They can break off and invade through the bloodstream, the lymphatic system. It's why we see cancers traveling to distant sites. It's how they get there. And across body cavity. So if you have uterine cancer, it can spread all through the peritoneum. If you have a cancer that's somewhere in the thoracic cavity, it can spread like the lungs. It'll spread first inside the thoracic cavity into the surrounding lymph areas. Retroperitoneal, if you have kidney cancer, it's going to invade organs there. So tumors that are cancerous do retain some characteristics of the original tissue type. And a biopsy is going to tell you exactly what type of tissue it arose from. And that's why, you might have a tumor in your bone. Let's say, person goes to the emergency room with horrible back pain and they find cancerous tissue in the spine. It may not have originated from bone tissue. It may have gotten there from metastasis. So it's important to biopsy that tissue. Cancer is classified according to its origin, not the location. So if a tumor is found in the lung, it might not be lung cancer. It might be breast cancer that was metastasized to that area. So that's just some information about metastasis. And we will break off there before we talk about inheritance.